So under the extended EHR joint action, work package 9 focus on the telemedicine service under MyHealth EU. And basically 2 tasks were the main goals. The first one related with the requirements and specifications for the cross-border telemedicine service under MyHealth EU. And here we look up to use cases, the business requirements, aligned obviously with the Article 13 of the EHS regulation. And then the other task related with the groundwork for the implementation of a cross-border telemedicine service, looking up to existing schemes under the member states, and also possible pilots that were already implemented. So as a starting point, it's important to, on a basic way, to understand that telemedicine is basically the use of a digital technology for the provision of healthcare in a remote scenario. And here we are on a cross-border context, so different a teleconsultation or a telemedicine service under 2 different member states. And the telemedicine is increasing due to the growing or the evolution of the digital tools that we have at the moment, and also the better connectivity in terms of internet that is spreading out worldwide. So here, I think it's important to understand that telemedicine is not becoming a trend, but it's actually a structural shift towards the provision of healthcare. So as a starting point, we had to define the use cases for the telemedicine service and the MyHealth EU. So we start digging into the literature, so what we had, and we look up to over 80 studies in order to have use cases that were evidence-based, and that could define our use cases for this work. And actually, this was an extra achievement that we had. So we published a scientific paper that was entitled Telemedicine and the European Health Data Space, a new paradigm for healthcare in the EU, in the frontiers in digital health, that I also invite you for a reading. So this scientific paper was published under the extended EHR joint action. And the paper looked up to 2 different areas. So the first one, the real-world case scenarios, where we had a category of care delivery, like teleconsultation and the telemonitoring. Then we have a diagnostic category, like teleradiology and telepathology. And then the intervention category, looking up to telesurgery and tele-expertise. And despite the search and the analysis of these real-world case scenarios, we also look at the main enablers and barriers for the implementation of telemedicine in a cross-border context. So we look at the MyHealth EU domains, legal, regulatory, organizational, technical, and semantic interoperability, but they also had a specific categories as well, looking at the possible implementation of artificial intelligence in this type of cross-border service. Here we had some of the results, but I think that it's important to understand that at the end, telemedicine is not just about convenience. It is actually a real measurable value in terms of the access of care, especially in people that is in remote locations. Also in terms of the quality of the outcomes, and also in terms of the innovation of the healthcare systems. So going through now, and after this analysis in terms of literature, we defined 2 use cases. So the first one, a teleconsultation between a patient and a health professional. And this is probably the most mature and common use case in terms of telemedicine. And then the other one, a teleconsultation or a discussion of a case between 2 health professionals. So going through the work that was done, We start by defining the actors that were involved in the teleconsultation, and here we are just proposing or showing for the use case between a patient and a health professional. So we define the actors, the patient, the healthcare provider organization, the MyHealth EU central services, and the national infrastructures, the NCPs, and others. And then we define a patient journey. So we divide it into 4 phases. So the first phase, scheduling, where the appointment is done, and all the arrangements are conducted. And then we go through a teleconsultation phase, where basically we can use all the categories that were shown previously to share data of the patient with the health professional in order for him or her to prepare to the teleconsultation. Then we have the third phase, the teleconsultation itself. And then the phase 4 will be the post-teleconsultation, where there is a continuity of care, and also a possible discharge report, and so on. So now I deliver to Irini that will go through the patient journey.
Thank you.